Hello, my name is Genesis Pareda, and I am going to present a speech demonstrating how to use an inhaler. Asthma is a worldwide condition on people with a respiratory condition marked by spasms in the bronchi of the lungs, and which causes difficulty in breathing. More than 15 million Americans have asthma, and about 40% of children with parents who have asthma will develop the disease themselves. The prevalence of asthma is higher in children than it is for adults. Therefore, we need to be able to explain to our children what an inhaler is and the different types there are, the steps needed to properly use an inhaler, and some tips to control an asthma attack if they were to forget their inhaler. Also, the signs to when it is needed to call 911. Let's begin by explaining what an inhaler is and the different types of inhalers. Inhalers are handheld portable devices that deliver medication to your lungs due to difficulty in breathing. Different people and different types of asthma ask for different types of inhalers. The first type is a metered dose inhalers consisted of pressurized canister containing a certain amount of medication that fits into a boot-shaped plastic mouthpiece. The second type is a dry powder inhaler that has multi-dose devices and single-dose devices that release the medication in the inhaler by breathing in a deep, fast breath. Now that we have a better understanding of the types of inhalers there are, let's explain how to properly use it. It is important to use your inhaler correctly, otherwise your airways will not receive the right amount of medications. These are the steps to properly use a metered dose inhaler. Stand or straight up, or sit straight up. Shake, remove the cap. Shake the inhaler. Tilt your head back slightly and breathe out all the way. Put the inhaler in your mouth. Press down on the inhaler quickly to release the medicine as you start to breathe in slowly. Breathe in slowly for 3 to 5 seconds. Hold your breath for 10 seconds to allow medicine to go deeply into your lungs. Breathe out slowly. Wait 1 minute before taking a second puff, or only repeat if directed by your doctor. However, carrying an inhaler around everywhere can be very forgetful, so there are some types you can use to control your asthma attacks. Asthma needs constant care and proper management at all times. However, if you are caught without an inhaler during an asthma attack, there are a few exercises you can do to control your attack. These are some tips you can do to control your asthma attack. Sit up straight. Stop what you are doing and sit upright. Bending over or lying down can interfere with your breathing. Take long breaths. This may help hyperventilating and slow down your breathing. You would have to breathe in through your nose and out through your mouth. Stay calm. This will prevent further tightening of your chest muscles. Get away from trigger. Asthma has many triggers such as dust, cigarette smoke or smell, and chemicals. Get fresh, clean air. Get a hot, caffeinated beverage. This will open up your airways slightly, providing an hour or two relief. Although some might not work, there are signs of the attack getting worse and might have to get emergency help. If you were not able to speak or use short words or phrases, coughing or wheezing is severe, feeling drowsy or tired, face or lips appear blue when you are not coughing, tightness or pain in your chest, or a fast heart rate. Asthma can be a tricky disease when handling it with a child and or adult. However, with this demonstration on the different types of inhalers, the proper steps in using an inhaler, and some tips on how to control an asthma attack without an inhaler can help you in how to teach your children properly in using an inhaler. I hope this speech can inform the audience how to teach their children about their inhalers. Also, the importance in carrying the inhaler with them at all times.